Thanks for coming to Coffee Talk today. I'm Stacey Brown Summers, and I'm the managing director and marketing guru here at Mindlink Resources. Um, and we just thought it'd be a great opportunity to use some of the tools that we have available to us and get together every once in a while and just talk. I got my coffee. I got you. Um, and I got stuff to talk about. Uh, the first thing, so we had a guest, and unfortunately, she wasn't available at this time. So we have a pre-recorded, and we called it Coffee Talk and Drive Time at the same time. And I also have another special guest here, which is Whiskers. He's my co-host, and he has not been off of me all morning, so I'm covered in cat hair at this time. So I apologize if you are not a cat person. Anyway, I had a conversation with Jana, and it was really kind of timely because yesterday I did a little networking meeting, which I sometimes do, and I had a follow-up meeting with a woman who I know is a nursing professor, and she invited me to have, well, what I thought was just a coffee meeting, casual, with her and some of her students, talk about some of the things they're doing, which I guess it was, but it was a little intimidating for me because I walk in and it's like obviously a classroom and I'm there as their guest speaker, which I wasn't really very well prepared for. So, but we had a great conversation about nursing, about language access, about some of the challenges that show up. And of course, right after the conversation, I called Jana, who I know is the executive director for the Oregon Center for Nursing, just to get her perspective and to see what kind of things she was hearing. Anyway, and we recreated this conversation, and I have recorded that for you to listen to today. So I invite you to listen. We were talking, Jana was in her car, my microphone wasn't the best, so forgive the quality, but hopefully you can get some good nuggets out of this conversation. Thanks again, and we'll see you after.
Well, I think it kind of goes to the idea, like I talk to a lot of nurses that are who are Latino or Latina, and they speak Spanish, like as a good example. They speak Spanish. That's like their primary language, and English is their second language. Or they grew up in a home where they speak English fluently because they lived in this country their entire life, but Spanish was spoken at the home. So they're very, they speak both languages very fluently. And it's really frustrating when they, go to work and there's this expectation that they're going to be the ones that are translating, and there are laws. There are very specific laws that can't be happening. That you need to have like someone who is trained in medical translation to actually be there providing that translation. So I hear stories like, but sometimes when you're in a moment of need where you just don't have time to go and do what you need to do in order to get the right translator, sometimes they'll just, grab somebody who they know is bilingual. But
Yeah.
The one thing that when you and I were talking about this, and specifically in relation to legislation requiring language translation for prescriptions, I like that idea. It's just like we were talking about, sometimes you do need to legislate things, right? Because because there is not another incentive in order to get people to change behavior. And when that happens, then yeah, you need to do some kind of a legislation. But there's also, with all of the different healthcare reforms that we've been having over the years, there's also an incentive for many healthcare providers to provide a real positive patient experience. And so that's the whole concept of value-based pricing, right? So there's a lot of different things that need to happen in order for something to get fixed. But it's definitely something to consider, and it's definitely something to consider for Oregon.
Yeah, yeah. I think the minimum expectation is to have an interpreter, you know, even over the phone, to be able to talk with the patient and make sure they understand. And it sounds like what these students said is that what they're finding is that doesn't even happen very often, especially at the pharmacy level. I think nurses use interpreters all the time, but it just seems like that was one option. We were like, well, why don't they just like print out something in Spanish or whatever and hand them the paper? And all the nursing students were like, do not hand anyone any papers. They just overwhelm the papers and they just go in the garbage.
Yeah.
But I think what you bring up is a great point, because there's kind of the time and convenience factor, but I think a cost factor is really huge. And so to be able to have a way to show that return on the investment in the way of patient satisfaction, that seems like a great solution.
Yeah.
And I'm like you, I don't know the answers. We're just having a coffee talk here.
Yeah. Except I think that shouldn't be called coffee talk. I think it should be called drive time.
Oh, okay. I like that.
Yeah. Instead of coffee talk, it'll be drive. Well, today is drive time. We're going to have the talk while I'm in the car.
I love it.
Yeah. That's funny when they say, well, don't give them anything in writing. Well, how are you going to, I don't know. They do need to give things in writing. There needs to be something in writing.
Well, and I realize there are literacy issues in different populations, and but at some point, when you're talking about a $1 million solution,
right,
you gotta explore every option, like you said.
No, yeah, exactly. I mean, yeah, I with a lot of nurses that have tried to come up with what they culturally competent discharge procedures, which I know that sounds really strange, but basically what it is that when you're discharging a patient from a hospital or from after any kind of treatment plan, you need to sit down, and before you do the discharge, you need to kind of sit down and make sure that they understand, what just happened to them. What was the procedure? If there was a procedure that happened, what was the procedure? How did it go? What were the results? And what's the follow-up going to be? And there was a group out at the Providence Hood River Medical Center many years ago that realized that the discharge procedure that they were doing with their patients, there was not a lot of cultural competence with that, right? They weren't taking into consideration language issues. They weren't taking into consideration, cultural issues. Mm-hmm. So they really did a revamp of their discharge procedures to make sure that they, if there was somebody there where English wasn't their first language and it was discharge, that they had an interpreter there to make sure that they, communicated as well as they possibly could all of the things that they needed to do for their discharge. So, and I love that the nurses in the class that you were talking to are looking at pharmacy, and I think that that's a fantastic idea. I think that's actually one thing that I adore about nurses in general is because, they are the people that are at the front lines of the healthcare fight, right? Mm-hmm. They are the ones that are seeing, they're seeing society, basically. They're seeing all levels of society, and they're seeing where the problems are, and they're trying to identify whatever fixes that they can possibly get. And I think that having any nurse-led effort that's going to improve the quality of patient care, which includes communicating, what their treatment plan is going to be, whether it's pharmacological or whether it's, medical. If they have some kind of way to be able to communicate that in the language of their patient, I think that's really important.
Yeah. Yeah, for sure. I like it. Well, listen, I don't want to take up all your drive time because you probably have your own podcast to listen to.
Yeah, maybe even a podcast to record. I don't know. You don't know.
Yeah. let's use that time, you know what I mean? You know? So we want to meet again maybe I'd like to do a discussion every couple of weeks, and if you'd want to be one of our regulars, I'd be more than, yeah. And we could talk about whatever, right? It doesn't have to be healthcare related, just that happens to be something we both touch in a way.
Yeah, that's the one thing that I have probably the most expertise on, but you know, I could talk about other things too.
Excellent. About dogs and daughters.
Dogs and daughters and coffee. Yeah.
And coffee.
I'm all about that.
Okay, I'll have to.
All right, we're just being goofy now. I'm going to end this talk. Hopefully I'll find that SNL reference. But thanks again to Jana for joining us. We'll have some more interesting conversations. Thanks for paying attention, and look forward to more discussions in 2 weeks for our coffee talk / drive time / whatever we're going to call this. All right. Talk to you guys later. Bye.
Welcome to Coffee Talk. I'm your host, Linda Richmond. On this show, we talk about coffee, New York, daughters, dogs, you know, no big whoop. Just coffee talk.